Hey, Dr. Seth Gilson, you there?
Hey Derek, I'm here. How you doing?
Hey, thank you so much for joining us today. How's your day going?
Of course, it's going great. How are you?
Hey, wonderful. Hey, I'd love to just read your bio real quick and kind of get our community members acquainted with you and kind of give them a little bit of your backstory. So, Dr. Seth Gilson was born and raised in South Florida, graduated with a degree in biology from the University of Florida, completed dental school at Nova Southeastern University, and was able to be in private practice since 2011. Dr. Gilson is a practicing functional and holistic dentist, as well as a certified yoga teacher since 2019. He has backgrounds in both clinical functional medicine principles as well as clinical research experience in the hospital setting. For his passion and for spreading healthful information regarding the benefits of lifestyle choices founded on the principles of functional medicine and functional dentistry, he created the brand called The Mindful Doctor and a show called The Art of Mindful Medicine, which can be viewed on his Instagram and YouTube channels. So again, thank you for joining us today.
Of course. Thank you for having me. I really appreciate the opportunity.
Hey, my pleasure. So I think when a lot of folks hear the terms biological dentistry, a lot of things come to mind, and I'm curious kind of what that term means for you and how it affects the way you practice here in South Florida.
Well, it's funny. If you talk to probably 9.9 out of 10 dentists, they've never heard of the term biological dentistry. So it is something you have to go look for, and that's why I a lot of times use the term holistic, because people just have an idea of what that generally gets a night or means. And I didn't really discover biological dentistry until about 4 years ago. So myself. So biological dentistry is basically a holistic body approach. It's grounded in scientific research, and it basically looks at how oral health and overall systemic health are correlated and related to one another, and how they play off of each other.
Yeah, I think that's really important too, because also being a fellow, Nova University graduate, I don't really remember ever hearing that term back then as well. And I've kind of been on this journey too for looking for additional avenues of information and following where the research can lead us. And I think it's interesting too that it doesn't have to be either or. You're either a conventional dentist or a biological dentist. I think both worlds offer solutions for our patients and what we're trying to achieve for them in terms of oral and overall health.
For sure. Yeah, I mean, conventional dentistry these days, I mean, it's very common for research and studies and things to be posted about and talked about, and doctors or dentists talking to their patients about cardiovascular risk and diabetes and things like that. It goes a little bit further than that.
That's a great point. And I'm curious, when people seek you out, what are people looking for, and why are they choosing the type of dentistry you can offer for them?
So, well, many reasons, but some of the most common reasons are really, first and foremost, is dental materials. Is that we use safe materials, which is why one of the things I use is and promote is Risewell, because it's a safe product that doesn't have caustic effects in the mouth. It's not a doesn't have hormone disruptors in it. It doesn't affect the overall systemic health of our body. So dental materials is definitely one of the major things. And one of the things that I've noticed that really touches home for me is that a lot of people feel very dismissed by their healthcare practitioners in general. So one of the things that I get a lot of is people coming and just thanking me for listening to what they have to say, and
Sure.
because they've created this lifestyle of health, and to me, health is the true wealth in our lives, and that is a connection that we make instantaneously.
That's a great point. You say a lot of good factors in there, and I noticed that in my practice too, where patients are looking for an opportunity not just to be treated well and improve their health, but to be listened to. I think there was a statistic recently where I read that the average time it takes for a physician to interrupt a patient was like less than a minute, which was pretty unbelievable. But I get it. There are economic forces and factors affecting the way certain people practice, and if you're in a high volume situation, sometimes you're not able to give people the time they're looking for. And what a nice advantage your patients have with you, that you're able to listen to them and really hear what they're looking for, and try and help them out with that. And you mentioned a lot of good points too in terms of materials and safety. And thank you. Yes, all of our ingredients are certified and cleaned by the Environmental Working Group, and we are the highest concentration of hydroxyapatite brand on the market with our nano and micro blends here. So it's really a nice opportunity to help with the remineralization process, and it's got a really nice effect for sensitivity relief as well. So it's been helping a lot of people, and I'm glad it's helping you guys in your practice as well.
Yeah,
Tell
definitely.
me, what does maybe a holistic dentist do differently than a conventional dentist?
Well, for starters, some of the big things is we don't use any fluoride. I mean, there's very few instances when I would suggest that you use fluoride, and that's in an extreme situation. Um, Obviously, we don't use mercury amalgam fillings, but when we are removing them, we do them in a very safe manner.
Okay.
Established by the organization, the International Academy of Oral Medicine and Toxicology. They've developed something called the SAFE method. It's safe amalgam. Yeah, this safe method, and we have oxygen on the patient. We wear
Okay.
gas masks and things like that because mercury vapor is a huge problem when it comes to amalgam fillings. So those are a few of the major things that we use. The filling materials also that we use, I predominantly try and use porcelain. But even in the composites that we use, there's no monomers like BSGMA and PPAs and things like that.
That's a
Did
great.
we break up? Just a little.
No, yeah, we lost you for a second, but no, we're back now. But you make a lot of points. Looking at what are we putting into our body? There are a lot of these traditional elements that we've been using for decades. Yes, that they filled teeth, they achieved some level of results here. But I think we're finding that in today's day and age, we just have better options available for patients, which is nice to decrease patients' toxic load and chemicals that maybe we shouldn't be putting in people's bodies. So that's great for you to kind of mention some of those things. And I'm telling you, so do you have a preference on in terms of your additional certifications or trainings, or when you have that safe method? It sounds like you've gone through additional education to achieve some of these levels of the way you practice. Is that accurate?
You broke up at the end. Say that again.
I was just saying, so it sounds like you've achieved a higher level of education and certifications to achieve like the safe amalgam removal and different ways you practice. It sounds like you've had some additional educational opportunities in this type of dentistry. Is that accurate?
Yeah. So through the IAOMT, they offer different courses and videos and meetings and things that we go to, and we gain the knowledge on how to really do these things.
That's great. That's really helpful. I think a lot of folks out there might not be aware of the different higher levels of education that you have and what it takes to practice in the way you do. So that's really good information. And I'm curious too. In dental school, look, I know people have used fluoride for many years, and it helped with certain aspects of tooth decay. But systemically, like there's no dietary daily allowance requirement for having fluoride systemically in your body. And I think a lot of people might be shocked by that because, in dental school, I don't think I ever heard the term hydroxyapatite. And, heaven forbid you talk something against fluoride. I was like questioning religion. So it is interesting to see that there are other elements and molecules out there that can act as a remineralizer. And I'm curious, when you first left dental school, were you still using fluoride, or what was your journey towards different materials or hydroxyapatite when you left school?
Yeah. So when I finished school in 2011, just like you said, and again, we were at the same school, I only knew hydroxyapatite as part of the anatomy of a tooth, and nothing that not in any kind of products or anything like that I was aware of. So yeah, at that point, I was still using fluoride myself. I didn't even actually realize how many products in dentistry, from polishing materials to obviously most toothpaste, but all the filling materials, and how much fluoride we're actually exposed to in just dentistry alone, because that's not the only problem. The problem is that there's a lot of environmental exposures to fluoride, whether it's through water or through our food, through the air, things like that. And it's the bioaccumulation of these things in our body that's causing the greater issue, not just one set of problems. So my journey, it was about 2018 when 2017, 2018, when I started to realize that even though I was talking to people about nutrition and things, I wasn't really helping them. I noticed that I wasn't best helping people prevent for example, cavities when we're in reference to fluoride. So I started realizing that I was more doing patchwork and just fixing problems rather than trying to prevent problems and helping people actually get healthier. So I started, and through the IOMT, like I had mentioned before, I had to do a lot of self-research and self-study because these things are not offered to us. So it was about 2018, beginning of 2018 to up to now, that I've really started to understand more about fluoride and the problems with it. And then obviously when more products like Risewell with hydroxyapatite actually started being used.
Now, I enjoy hearing your journey to these more updated sources of information here. And also it's interesting too, looking at some of the connections of nutrition. I think a lot of this goes back to nutrition, and I'm a podcast junkie, and I forget which podcast it was, but someone had mentioned the works of Dr. Weston Price, a dentist from back in the 30s, who took time to leave his practice and essentially travel the world looking at some of the differences between native traditional populations that were still kept away from the quote-unquote Western diet, and those other populations that were introduced to the Western diet, bleached flours, sugars, and he really was able to examine some of the different decay rates in the populations. And lo and behold, those populations that were not using the flours and the sugars and eating a more traditional whole food lifestyle had a very low caries incidence. So it's interesting that this information has been around since the 30s. But I hear so many patients that come to our office and they're really wondering, like, gee, doc, why do you care about what I drink or what I eat? Like, just fix the tooth. And it's like, well, Mr. Smith, the connection between what you're eating is greatly related to why your teeth are rotting away. So we need to talk about soft drinks. We need to talk about acids and sugars. And I'm curious about your experiences in your own office and how nutrition kind of plays a role in what you do.
Yeah, I mean, very, very similar to what you just described. And ultra processed foods is essentially what I've come to realize is one of the worst things for our body. But what it does is it affects the oral and gut microbiomes. And that's where the detriment really comes into play. And in addition to, like, when Dr. Price had traveled around the world, finding all these different rates of cavities in these indigenous cultures that, as you said, were not impacted by Western diets or Western civilization at that point, he was also noticing that their jaw development was different. They actually had fully developed jaws. And then
that's a great point.
Affects our airways,
yeah,
and the way we breathe. And the way we breathe affects our overall health as well as our oral health.
That's a great point.
Like, these are all the conversations that I go through with a lot of people on a pretty much daily basis.
That's a great point. Can you expound upon just different breathing techniques and what's the preferred way to breathe to help our oral microbiome and teeth?
Yeah. So what I instruct people to do, and do myself, is to try and breathe as close to 100% of the time through your nose. So we have these two orifices. This one's for breathing. This one's for talking and eating. So we don't want to breathe through here because the nose actually is has some really special features because it filters the air as it goes in, but it also actually has this really great benefit that when we breathe air into our nose, like I said, it filters the air that goes to the lungs, but it also helps release nitric oxide. And nitric oxide helps relax the blood vessels in our body. So it can actually help relax us in general, but it also helps promote better cardiovascular health.
Yeah, it's a great point. Looking at the relationship between preferred breathing techniques, the oral microbiome, overall systemic health. And it's interesting, too, that a lot of the patients I get, we have a very senior patient population here in South Florida, in my location. And some of the things that is really detrimental for folks is dry mouth. I mean, stemming from xerostomia, which is the scientific term for dry mouth. It's a side effect of a lot of medications these older folks are on. They're mouth breathers, and they just have a lower salivary flow just from being at an increased age. And that is so detrimental for their decay rates, because saliva, for a lot of folks out there, just so they know, saliva has a wonderful protective and buffering capacity against cavities. It helps to bathe your teeth in a layer of calcium and phosphate, which creates a supersaturated solution for remineralizing any incipient lesions, and it also makes sure the pH doesn't drop too low. So caries usually occur when the pH drops below 5.5, and when you have a dry mouth, you're at a higher likelihood of having your pH drop. So in addition to breathing through your nose, it keeps your mouth closed, keeps your saliva full and robust. So saliva has so many protective advantages to help ward off incipient lesions.
Yeah, 100%. And like as you were saying, with an older population, I mean, unfortunately, as we get older, we in this country tend to be on more medications, and a lot of the side effects of these medications are dry mouth. So, and besides that, at night when we sleep, about 60% of us generally breathe through our mouth at some point in the night. So all of this leads to dry mouth, and that's probably the number one unspoken about cause of cavities is breathing through our mouth.
Yeah, no, you're darn right. And I'm curious too, when patients seek out your practice, are they looking for certain procedures or removing toxins or removing their amalgams or why do people seek you out?
So I would say the top three reasons are the materials that we use that are safe and effective and don't, for example, like not having fluoride, and mercury amalgam, safe mercury amalgam removals, and then consults regarding root canals.
Okay.
Those are the most common reasons that people come to see us.
Tell us more about the root canals and your philosophy and how you approach those kind of cases.
So root canals, this is a heavy debate, as you're fully aware of in dentistry. And as you probably have, I've done many root canals in my past. And honestly, what I see is just a lot of, mostly what I've seen over the past 13 years is just failed root canals. There's generally always some kind of a lesion with a root canal tooth. Now, the standard that I approach things is if someone's coming in and if there's no obvious lesion or anything like that, I usually suggest people have a CT scan because then we can see things in 3D, because the x-rays that we take in the office are two-dimensional pictures of us, which are three-dimensional objects.
Absolutely.
So we can see everything that's going on. And the anatomy of teeth and the structures in our mouth and our jaws are complex, so sometimes you just can't see everything. So some people just want them out for a variety of reasons. So then we have to have a conversation about why they want them out and the risks and benefits and things like that. But if there's nothing that we can see is visually wrong, how I approach it is it's optional to them what they want to do with the tooth, but it's something that we'll continue to monitor over 3 to 5 years. And
I like it.
With another CT scan. But to the credit of endodontists and root canal specialists, root canals today versus 5, 10, 15 plus years ago are a totally different ballgame. I mean, they have improved their methodology tremendously. There's something called the gentle wave technique, the fact that doctors use microscopes and things like that. It is like night and day compared to how root canals are done by those particular specialists that use those techniques. However, there's, to my knowledge, and I try to stay pretty on these things, there's no evidence to show that we can completely sterilize the inside of a tooth using a root canal. And that just leaves people susceptible to a failed root canal and abscess, and which can contribute to other systemic health conditions in the future. How that's going to affect me versus how it affects you versus anybody else, you don't really know.
Yeah, you bring up a lot of good points there, and I think a lot of it just goes back to preventative medicine. Don't let the decay get to the point where a tooth is in jeopardy of a root canal. It really goes back to keeping up with your healthcare providers, your dentists, your team, and nutrition, and keeping the sugars away, preventing those incipient lesions from getting worse and leading to that point. And it's unfortunately very deceptive, because I almost wish incipient lesions hurt. I almost wish enamel had sensation, because then people would realize, oh wow, my tooth hurts, something going on. But you don't really feel anything until it's already penetrated the dentin, and by that point you need intervention. And it's a little unfortunate. I wish people felt it earlier. Yeah. But anyway, you previously mentioned some of these oral systemic health connections, and I'm curious, are there any other oral systemic health connections, like connections with the heart or connections with the brain that you've seen or heard about through your research that might have an effect on oral health?
For sure. I mean, there's a lot of them, and I mean, there's plenty of documented research out there on the effects of oral health and how the microbiome of our mouth affects the gut microbiome. Or, well, the gut is the mouth is the first part of the gut, right? So, but we like to talk about these things differently. But the different microbiome makeup in our mouth is, like I said, different from the lower GI tract, and those two parts of our body are impacted by one another, and that impacts, like you said, neurological health. I mean, Alzheimer's disease is connected to periodontal disease, which is dysbiosis of the oral microbiome. Certain types of cancers, cardiovascular disease, like you had mentioned, certain autoimmune issues. I mean, Hashimoto's thyroiditis. I've seen so many people come in with Hashimoto's, and once they resolve some of the issues that they have in their mouth, whether it's an infected root canal or severe periodontal disease, and they go into remission with all of these things, which is, I mean, and this isn't me just saying it. I've had, I don't even count those patients just come in and tell me these things.
Yeah, that's a great point too. And along those lines of like the thyroid conditions, and I believe fluoride is such a reactive molecule on the periodic table that when it displaces the iodine and really detrimentally can affect the thyroid health, because if a fluoride is taken systemically. Is that accurate? I'm not sure if I said that pathway correctly.
Well, that's exactly what I've read. The other thing that I've found is, like I had mentioned a little earlier, is that the fluoride actually bioaccumulates in our body and can affect the pineal gland in our brain.
Yeah. Yeah, it's really interesting, and as more and more research gets out there, it's important with channels like yours to just disseminate this information and just help people make more informed decisions.
Yeah, it's just, I have this philosophy of being a lifetime student, and I don't like to say I'm an authority on anything, because look, anybody that knows anything about science and medicine, or anybody that is worth listening to, would say that if there's new evidence, that they're willing to look at it and are willing to change their stance on an issue based off of new evidence.
That's a great point. So Seth, tell us about your practice, and do you practice alone? Are you with a partner, or what's your arrangement, and how did you kind of find that opportunity after dental school?
Yeah, so I'm currently working with Dr. Freda Rosenbaum, who is a beautiful soul. I call her the OG of holistic dentistry here in Florida, or specifically South Florida. She's been doing this for 34 years, I believe. Down in Aventura, Florida, and she has really created a beautiful environment. And how we got in touch is actually one of my favorite stories. It's quite serendipitous, and as I had mentioned, I kind of touched on a little bit before that I had been going through a little bit of a personal revolution, so to speak, in 2017, 2018, and through that I found yoga. And a lot of people are like, oh, yoga, what? And they have these ideas about what yoga is. But really, for me, the philosophy of yoga is what I find to be really beautiful, and the connection that we have with our surroundings and other people, and most deeply is with ourselves. And once I learned to kind of deepen that connection, I had a better understanding of myself and how I wanted to show up in the world. And fast forwarding a little bit from there, in 2020, when the pandemic happened, we weren't able to work, and I was an associate at that point. I was just told 3 months, like, don't even come into the office. So I really had nothing to do as far as work goes, and I had been wanting to start some kind of something to share with people. So I started what you had mentioned earlier, the Art of Mindful Medicine, and this Instagram page, the Mindful Doctor. And through that, I had been connecting with other healthcare practitioners like yourself, functional medicine doctors, Chinese medicine doctors, cardiologists, people, anybody that wants to share their journey about how they've kind of reached this point in their life and in their practice. And through that, I met Dr. Carolyn George, who's a functional medicine doctor in Sawgrass down here in South Florida, and getting to know her. She's on the channel, and about a year later, after just corresponding, getting to know one another better, she said, you should really reach out to my dentist. I think you guys would get along. And I had already been I was working at 2 different practices, had no intention of leaving those practices at that point. And that's when I met Dr. Freda Rosenbaum. So she and I went to lunch and just hit it off. And like I said, serendipitously, I met her, we connected. the associate she had working for her at that point was leaving. That she actually gave notice that day, so we have been together ever since, and that was about 2 years ago.
Hey, that's great. I love hearing people's backstory of how they come to where they are, and thank you for sharing that.
For sure.
Are there any other topics that you wanted to hit today, or things that I didn't illustrate quite gracefully?
No, I think you illustrated things quite well. There's just, I guess there's a couple points that we mentioned nutrition a couple times, and
Yeah.
that's a huge that's another ball of wax that, I mean, people can get lost in multiple different rabbit holes, and I just would like to kind of share my perspective on
Please.
how I tell in general
Yes.
about nutrition and really kind of what I do myself.
Please.
I was vegan for almost 4 years, and for me, being 100% vegan just didn't work for my overall health. And so I would say I'm more about 90 to 95% plant-based at this point. But how I generally speak to people is about 75% of our diet should be those vegetables and fruits. And then the other thing, that because of the prebiotic and probiotic fibers and things like that promote a healthy oral and gut microbiomes. The other aspect of it are the proteins and fats. And we don't really think about the fat-soluble vitamins and all these other nutrients that are in these different types of food and how to get them from different sources. And not everybody can absorb all of these different nutrients from all the same foods as other people. So this is why functional medicine has become so important in my life, because we have to figure out for ourselves kind of how our bodies are best operating with the foods that we eat. So focusing on fat-soluble vitamins A, D, E, and K work. It's an extremely important pathway with D3 and K2 to help promote remineralization of our teeth and bones.
Absolutely.
And that's very devoid in purely vegan diets. So it's just things that we need to be aware of, and to have a better understanding of why we should be eating a particular way versus an ideological shift that kind of tells us we need to be eating a particular way.
Yeah, that's a great point. I currently do not prescribe to a particular diet, but I in the past did try to go vegan after watching a documentary, and really had a hard time with it, and maybe I wasn't doing it right or needed to taper myself off animal proteins at a slower pace. But anyway, had a really hard time with it. So I try and just, really my philosophy now is just minimize processed foods, minimize sugars, and just try and eat as whole, natural foods as possible with minimal ingredients.
Yeah, it's really just about the quality of the food. And unfortunately, that's even a conversation we have to have these days. But whether it's organic vegetables or beef that's regeneratively raised and farmed and grass-fed, grass-finished, and all the different labels that we've had to come up with these days. But the quality of the food is the biggest aspect of these things, because what we eat, it becomes what we're made of, right? Like what we feed ourselves and what we feed the bacterial cells in our body is what determines our overall health.
Yeah, that's huge. I mean, I think I read a book recently called 10% Human, where they're looking at how a lot of the cells in our body are not human. They're bacterial in nature, whether it's the oral or gut microbiome. It comprises a huge percentage of our body, and the interplay of those bacteria with our body and different signaling pathways that happen. I think the expression "listen to your gut" exists for a reason, because when you're about to make a big life decision, you kind of feel it in your stomach. And I think it's so important to just be aware of these different topics, and more research is coming out showing the interplay of the microbiome on the rest of our body, and how looking at decay rates and caries, it's really an interplay of many bacteria. I know Strep mutans gets all the attention and accolades, but it's really a consortium of bacteria that probably relate to a lot of these different conditions. And I'm curious, how do your patients react when you talk to them about nutrition? Are they receptive? Do they kind of understand why you go down that rabbit hole with them?
Yeah, I'd say 9 out of 10 people are extremely receptive to it, and actually like extremely grateful, because like I kind of alluded to before, that people generally, unfortunately, practitioners for a variety of reasons just don't take the time to go over these things with people. But it's extremely important. I mean, one of the things you and I talked about is that you can use the best toothpaste, you can use the best products in every which way you want. But if you're not eating well, if you're eating ultra processed foods and your oral microbiome is dysbiotic, you're going to have cavities and gum disease and potentially other those are risk factors for a lot of the other things that we just spoke about. And as you said, like strep mutans is like the big bacteria that gets all the attention, but when it comes to the oral microbiome, I mean, we have millions and millions of bacteria in our mouths and in our guts. And it's not necessarily more of this one or more of that one. It's really about a unique balance. How I describe it to people is that the oral microbiome is like a fingerprint. It's very unique to every single individual. My microbiome isn't balanced the same way your microbiome is balanced. So we have to find how that works for the individual, which is the same thing with functional medicine. Because, for example, when I was vegan, I felt okay. Maybe it was a little bit off, I guess is a way of putting it, but I didn't know how good I could actually feel again. Because at the beginning, I felt great, but then my omegas became imbalanced, my homocysteine was high, B vitamins were low, and I tried to supplement myself into health, but it didn't work for me. Some people it will work for, but some people it doesn't. So we have to be able to test these things, and now we have oral microbiome testing kits, for example, through I think Bristol is one, oral DNA labs. There's a bunch of different ways that we can test and actually get a really great breakdown of the patient's oral microbiome and see what's going on. And you can see if there's an overpopulation of certain what are more commonly known to be disease-causing bacteria or not. But like I said before, it's about finding the unique balance, because if you have an overpopulation of a quote-unquote healthy bacteria in your mouth, that can still lead to a disease state.
Yeah, you bring up a lot of good points there. I love that fingerprint analogy, and it's interesting the shift in healthcare and medicine from times past where bacteria bad, must kill everything, just pour alcohol on it, pour antibiotics on everything, and we probably were inadvertently yes, we're killing bacteria, and if you have an infection in certain instances, but at what cost to other people who take them willingly disrupt your gut microbiology to the point where it affects other aspects of your health and really just willy-nilly taking antibiotics to kill to that balance that you were talking about.
Sorry, it got a little choppy in there. I didn't quite catch the end of that part.
Hey, no worries. No worries. I was just mentioning how the shift in medicine away from the scorched earth, kill everything with antibiotics,
yes,
to more, like you said, a balanced approach, and that's kind of the approach we take here to Arisewell with our pH balancing mouthwash. I mean, we're not using an alcohol-based formula where it's just kill everything at all costs, because then you create these ecological niches where other bacteria can come in, and your proportions and your balance is thrown way out of whack, and you can create sites for deleterious bacteria to take over, and potentially those are ecological niches for bacteria that cause periodontal disease, or ecological niches that cause caries and other detrimental effects for your health.
Exactly. I mean, it's so funny, and I've done reels and posts on this, that the mouthwashes that say it kills 99.9% of bacteria. I'm like, that is the opposite of what you want. Literally, yeah. And with oral antibiotics like amoxicillin and things like that, I mean, unfortunately, sometimes people do need to take antibiotics. And you mentioned probiotics, and I'm a big proponent of probiotics, but I prefer getting it from food. So what I tell patients when I have to give them any kind of antibiotic is 2 hours before and 2 hours after the antibiotic to eat probiotic foods, probiotic rich foods. My personal favorite, sauerkraut, but any of the probiotic rich foods, live probiotic rich foods that do not have sugar or are very low in sugar are the beneficial ones to have.
I like that. Yeah, that's good. I really enjoy all the topics and wealth of information you bring to the table, Seth. And I'm curious, what has you excited for the next 5 years, and what's on your time horizon? Any fun projects coming up, or things you want to share?
Well, um, we are working out a partnership right now with the practice, so I'm really excited about that. I'm extremely grateful for the opportunity and to really grow this practice in a way with Dr. Rosenbaum that we have that nobody's really had the opportunity to do in the past, and that's via using social media and really expanding the practice in a different type of online community.
I love that. And social media and live videos have made the ability to share information so much more readily accessible. And we live in such a great time to have this technology and tools to get our message across. And we have a couple questions from our viewers out there, and I want to open it up to more folks with questions. So, Savinop PJ asks, my kid is being recommended sealants for caries. What other options would you suggest? Do you guys do sealants and treat kids in your office?
I do. I'm the one that sees the kids.
Okay.
I am not a fan of sealants.
Okay.
And I think she maybe it was just a miswording, but you don't use sealants to treat caries
Okay.
or cavities. Yeah, sealants are ideally to prevent cavities, but 9 out of 10 people that I see with sealants generally develop cavities underneath those sealants for a variety of reasons, but that's the main reason why I just don't promote them and don't do them myself.
Do you think that's the actual material composite or the sealant, or is it the operator who's doing it, or saliva contamination, or what's your philosophy on that?
I think it can be from a lot of different things. I think it's in with respect to the material itself. Sealants are generally a very weak material. So a lot of times what I'll see in patients is that half of the sealant's gone at, I don't know, X time later. And then you have part of the tooth that has a sealant, part of the tooth that doesn't have a sealant. And bacteria is very good at getting underneath those areas and into the little crevices of teeth. And that's where cavities develop. And like you said before, you don't feel these things until it's a really big problem. And the other analogy I use with cavities is think of it like high blood pressure. Unless you have extremely high blood pressure, you don't know that you have high blood pressure until somebody puts a blood pressure cuff on your arm and says, hey, look, your blood pressure's high. Until we look in someone's mouth or take an x-ray to look in between their teeth to actually see if there's a cavity, a lot of times you're not going to see these things. And
That's a great point.
I would also imagine that it is a lot of user error because in my experience, a lot of times that the doctors have hygienists placing the sealants.
That's a great point.
And it's not trained in these and things and stuff like that. But like you said before, a lot of these practices are high volume. So they have to do things very quickly. And
yeah.
You keep a child's tongue and lip and head just from not moving and keeping
Forget about it.
It's like you're not gonna, a hygienist isn't going to do that by yourself.
Yeah. Yeah, so I think to answer that person's question, if done properly, there's benefit, but most of the time there's probably saliva contamination, moisture contamination, lack of time for the procedure, and they can break, chip, and lead to decay underneath them, unfortunately. Next question. I have one mercury filling. Should I get it removed, or will that cause more harm than good from Cottle's Beach? Dr. Seth, what's your philosophy on that question?
So what I find is that most amalgams have something going on with them anyways. Either they're causing fracture lines in the teeth, or there's decay underneath it. And it's not necessarily decay that's very well seen, because when you look at these things on an x-ray, as you know, the metal's really bright and it just kind of blocks everything else out unless there's a huge cavity surrounding it. But what I've learned is that the discoloration in this tooth is the metal mixing with bacteria that causes cavities. And usually I recommend taking these out. Now, an amalgam, a small amalgam, there's nothing wrong with it, and the patient doesn't care, that's fine. Because I'm all about giving people the information and then letting you make fully informed, educated decisions about your health. I'm not going to tell you one way or another what you should do or shouldn't do. I'm just going to give you the information and have a discussion with you. People sometimes ask me what I would do. I wouldn't want mercury in my mouth. I've just seen too much of what it does to other people, and I've looked at independent research as to how these things actually affect our bodies. Same thing with fluoride.
No, all good points. Thank you for sharing. Little Meeps asks, if an oral microbiome test indicates dysbiosis, what is an evidence-based solution to correct this? From my understanding, there is no proven solution to modify the oral microbiome. Any thoughts on that?
So yes, there's everybody's different, like I was saying before. So it's very difficult for me to say what you over this kind of medium can do to fix these types of things. However, removing toxic chemicals, changing your diet, like we were just talking about before. For me, nutrition is the foundation for everything. If you don't have proper nutrition, and if you're not feeding the good microbes in your body, the proper nutrients that they need, like fiber and things like that, anything else you do isn't going to matter. So you have to start at the ground level and build up from there. And again, unfortunately, it's hard for me to answer these kind of questions in this way, but there are therapies and things that we use like ozone and other homeopathic remedies that certain people need.
You make a great point. It is I think as more and more research comes out, we'll have more and more answers for how best to treat folks. But yeah, unfortunately, medicine kind of comes down to customized one-on-one care, and hard to have a generic prescription for the population when these dysbiosis and equilibrium is out of sorts here. So I know we're kind of coming up on some of our time, and I want to respect your time as well, but maybe one more here. So from Selena Margarita, my mother was diagnosed with periodontal disease and was advised to remove a molar that is causing pain. The dentist said there is not infection causing pain in that area, only bone loss or density loss. Can you recommend anything to help with pain, or is removal the best case scenario?
Well, one thing is if they've been told they have periodontal disease and they have bone loss and they need a tooth extracted, there is very likely an active infection there. So as far, I mean, again, it's really hard for me to answer that question as to do without actually seeing the patient. But it sounds like, I mean, again, periodontal disease, so active dysbiosis and significant bone loss around the tooth, usually those teeth do need to be extracted.
Yeah, so again, as a caveat and blanket statement here, you know, without radiographs, without actually seeing people out there, we can't give specific advice for people. So please consult with your dentist here. We're giving kind of general guidelines, not individual tailored prescriptions for people to follow. So please make sure someone who's physically examining you and reading your x-rays, because we can't do that over this format.
Sure.
Again, Seth, thank you so much for joining us today. Tell us how we can support you. How can the Risewell community help you, and where can we find you and your work?
Yeah, so like I said, the practice is here in Aventura, Florida. Mindful.doctor on Instagram, on YouTube. The Art of Mindful Medicine is the show that I created. www.mindful.doctor is my website. I'm currently trying to get all the YouTube photos. We just started working on that to get that on Spotify to actually make an official podcast. So those are some of the ways you can find me. And feel free to reach out on this medium. I try and stay on top of the messages and things like that. I will get back to you guys if you do have questions or need anything.
Hey, well, Seth, thank you so much for taking the time and joining us today, and we wish you a wonderful weekend.
Awesome. Thank you, Derek. Appreciate you, and you do the same.
Bye-bye.
Have a good one.